The Aluma Skin Renewal System for the treatment of wrinkles, fine lines, and skin laxity. Aluma Skin Renewal is a revolutionary technique that delivers energy safely and comfortably to the underlying layers of the skin, gently stimulating the production of new collagen while protecting the outer layer of the skin. This video is not intended to be a substitute for hands-on training by a qualified professional or for reading your Aluma operator's manual. First, we will explain the science behind radiofrequency and Aluma skin renewal treatments. Collagenesis is the clinical mechanism of heating the dermis, denaturing the collagen, and initiating a natural healing process. The healing process regenerates collagen in a more youthful, organized configuration, plumping the skin. In addition, collagen contraction is possible. Radiofrequency, by nature, always takes the shortest path from the source to the ground, and heat is generated when the RF encounters resistance in the tissue. There are 3 different radiofrequency technologies currently being used for wrinkle reduction and skin tightening. In the monopolar technique, used by other systems, the RF travels from the electrode to the grounding pad, traveling through the body unnecessarily. This technique can be painful. Another technique, used by yet another system, is known as flush bipolar. In this type of system, the energy flows across the superficial layers of tissue, causing heating of the epidermis with less heating of the deeper tissue. Aluma's revolutionary technology, called FACES, Functional Aspiration Controlled Electrothermal Stimulation, is a parallel bipolar technique. The Aluma FACES technology is superior to these other methods as it concentrates the RF energy in the targeted area and generates heat deep in the dermal layer, protecting the epidermis. This technology combines radiofrequency and a vacuum in a controlled pathway. The Aluma system allows you to control the tissue being treated. The vacuum draws and holds the tissue between 2 electrodes. Conductive lotion minimizes resistance and heat generation in the epidermis. The RF energy passes through to the target tissue, generating heat in the dermal layer with little to no pain. Collagen is contracted and becomes regenerated as the healing process begins. The preparation of the patient should include reviewing their medical history for any contraindications and explain the procedure and possible side effects. Setting realistic expectations will enhance patient satisfaction. Be sure to have the patient sign a consent form for treatment. It is recommended that you take before and after photos. This enables you to show the patient his or her visual improvement. Explain to patients that they can expect to feel a warm, tingling sensation. Most patients will have mild erythema, reddening, lasting from a few minutes to, in some cases, several hours. All other side effects are very rare, but could include bruising, itching, contact dermatitis, blistering or burns, change in pigmentation, infection, or an allergic reaction to the conductive lotion. If you're treating a patient for wrinkle reduction, you'll need to determine the elastosis level. This is done by comparing the patient to the photos in the Fitzpatrick-Goldman classification of wrinkling and degree of elastosis scale, which is provided in your operator's manual. Patients who are evaluated to be between a 2 and 6 elastosis level have been found to have the best response. When treating a patient for skin tightening, you'll need to determine the level of laxity. This can be done by using the Skin Laxity Comparative Scale, which can be found in your operator's manual. The scale will assist in determining if the laxity is mild, moderate, or severe. In the following example, we will treat a patient for wrinkle reduction. On the menu screen, choose Wrinkle Treatment. The treatment screen will appear. Press the stethoscope icon to display the clinical indication screen. Here you can choose an anatomical area: periorbital, cheeks, perioral, or jawline. Press on the button indicating the area you're treating. In this example, we will treat the perioral area. Next, choose the elastosis level. The Lumenis presets will appear. The L is highlighted in purple, indicating the Lumenis treatment parameter presets are being shown. Press OK. The treatment screen will show the pulse settings and vacuum level. The presets include the pulse settings in time, indicated in seconds, 1 second to 5 seconds in half-second increments, and pulse level, 1 to 5. The vacuum is shown in levels from 1 to 5 as well, with 1 being the lowest level. The total energy delivered during a pulse is equal to the time multiplied by the pulse level. Each pulse level is 2 watts. In this example, 3 seconds times a pulse level of 1, or 2 watts, is equal to 6 joules. Next, you will choose a disposable tip, either small for wrinkle treatment or large for skin tightening. The tip is removed by pulling it straight off and then replaced by lining up the vacuum port and computer chip and pushing straight on the handpiece. Once the tip is inserted, it can be rotated to ergonomically accommodate treating various areas of the face or body. The Replace Head or Tip screen will allow you to identify the head and tip serial numbers and total number of pulses. Choose either the head or tip to identify the respective information. Press the X to return to the treatment screen. The tip size currently on the handpiece is indicated on the treatment screen. The treatment area should be clean of makeup, moisturizer, and sunscreen, which could interfere with the conductivity of the electrodes. Apply a thin layer of Lumenis conductive lotion to the treatment area. This lotion is specifically formulated to increase the conductivity between the RF electrodes. Do not use any substitutions. A spot test needs to be performed before treatment. An additional spot test should be conducted before treating a different area or if you change the setting. To perform a spot test, press the Ready button on the treatment screen. The Ready indicator will highlight and a tone will be emitted when the system is fully charged. Position the tip so that it's parallel to the long axis of the wrinkle. Ensure the tip is in full contact with the patient's skin without applying pressure. Depress and release the trigger button. The system will emit a tone and the blue light will illuminate while RF is being emitted. When the trigger button is pressed, the vacuum is activated, drawing the tissue into the treatment chamber. When the device confirms tissue contact, it will then emit the RF energy at the pulse level and duration indicated by the settings. If at any time the patient feels discomfort, the RF can be terminated by simply pressing the trigger button again. Wipe off the lotion. Then, after 15 minutes, examine the treatment site. Observe the tissue response and ask the patient what they felt. The clinical endpoints are mild erythema and a warm sensation. When you're observing the skin's response, place the system in standby mode and turn the vacuum off by pressing the vacuum icon. The vacuum pump is on when the vacuum icon is highlighted green and off when it is red. If the desired response is achieved with no adverse reaction, you may continue treatment. The area treated can be identified by a slight indentation and mild erythema in the shape of the chamber. If the patient feels no sensation and the skin has no change in color, consider one of the following: increase the pulse level or increase the time. On the other hand, if the response is too pronounced, such as moderate to severe erythema, reduce the energy by one of the following: decrease the pulse level or decrease the time. If signs of bruising are seen, decrease the vacuum. If any parameters are changed, perform another spot test and reevaluate the patient and skin response. Adjust the settings until the clinical endpoints are met. Then, the treatment may continue. Reposition the treatment head to overlap the previous treatment area by 10%. Multiple passes, up to 3, may be used. To achieve optimal results while maintaining safe operation, a change of treatment parameters may be recommended when applying a second or third pass. Following the first pass, it is recommended to apply cold packs to the treated areas. When the treatment is complete, clean the lotion off the treatment area. You may notice lotion is collected in the tip's filter. Remove the tip and dispose of it. Post-treatment, it is recommended the patient avoid hot water for 24 hours. Apply sunscreen SPF 30 or greater, and avoid direct sun exposure for 1 week. Next, we will perform skin tightening. On the menu, select the skin tightening icon. The treatment screen will appear. Press the stethoscope icon for clinical indications. The anatomical areas you can choose are facial laxity, facial folds, neck, arms, or abdomen. In this example, we'll select neck. Next, assess the patient's skin laxity level. The skin laxity scale is explained in your operator's manual. Once determined, press the skin laxity level. The preset treatment parameters will appear. Press OK to return to the treatment screen. When performing skin tightening, the large tip is normally used. The pre-treatment guidelines are the same as for wrinkle treatments. Prepare the patient's skin by cleaning the treatment area. Then apply a thin layer of Lumenis conductive lotion. Press the Ready button when patient and operator are prepared for treatment. Be sure to always conduct a spot test before beginning treatment to determine optimal treatment parameters. Confirm there are no signs of adverse reactions by waiting 15 minutes and observing the test spot sites. Adjust parameters the same as for wrinkle treatments, based on skin response and patient's feedback. You can also review the guidelines in your operator's manual. When treating for skin tightening, the long axis of the tip should be placed perpendicular to the desired direction of tightening. Multiple passes, up to 3, can be conducted parallel, perpendicular, or on an angle based on desired direction of tightening. Patients should be aware that slight post-treatment erythema, reddening, edema, swelling, and some discomfort of the treatment area is possible. The recommended treatment course is 4 to 6 treatments total, performed every 1 to 2 weeks. The patient's satisfaction with the results may determine the number of treatments. The physician can decide whether additional treatments are necessary. You may save one set of defined user parameters for each clinical indication. To set user parameters, you must first choose clinical indications. For example, select skin tightening, neck, laxity level moderate, then press OK. Now the parameters can be manually changed. For example, perhaps you would like to increase the time. Press the increase arrows to the desired time. Press the floppy disk icon. The Save as User Preset screen will appear. If previous user parameters were set, this will be indicated in the Current Parameters box. The new parameters are displayed in the box on the right side. If you want to accept the new parameters, press OK. When the